Everyone, welcome to AirwayDoc. Today we are discussing spinal versus general anesthesia. Spinal anesthesia is a type of regional anesthesia. In this, a drug is injected into the lower back into the CSF. It blocks nerve signals from the lower part of the body, so the patient does not feel pain but remains conscious. It is commonly used in C-sections, lower limb surgeries, and urological procedures. And now, what is general anesthesia? General anesthesia affects the entire body. It makes the patient completely unconscious. The patient does not feel pain and is not aware and does not remember the procedure. It often requires airway management like a mask or tube to help breathing. It is used in major surgeries, long procedures, and surgeries where complete unconsciousness is required. Thank you for watching. Subscribe for more.